I've now completed on the lathe shaping the lower appliance. Now, you may not be able to see this, but there's a little bubble known as a ramp in the front part of this appliance. It's flat on the back, but it's just a little rise. It's a ramp. You have the reverse ramp on the top. I'll just have to show you this, where it's fairly flat here, but then it rises up. That creates what's known as anterior or front tooth disclusion. In other words, as the jaw moves a little bit, this ramp opens up the back teeth that allows the jaw joint to have room to rehydrate, perfuse with blood, and get rid of any lactic acid that causes the joints to be tight, tired, make noise, and be painful. Also relaxes the jaw muscles, which is why we're doing it. So right now, I've already programmed the top. And so I've taken the lower model off the lathe, and I've set the articulator, and all of a sudden I'm looking, and now we're in a position of doing what? Grinding in the occlusion. Occlusion is the bite record that we need. That's the base position for treatment. In other words, the stable position. So right now, the appliance needs to hit pretty much everywhere with the upper appliance. And so I take a piece of paper called articulating paper. This one has a lot of holes in it because I used it for her upper appliance. But it's marking paper. It's like carbon paper. So it's red on one side and black on the other. And so basically, I'm doing this with the jaw, and right now only the left side hits. So I undo that. I look for the marking. And when you shape or grind these in, you have to do that several times. So I'm using an acrylic burr. These things are called burrs. I take that spot off. I hold this in place. Now I don't have to click it because I know it's going to be high. And it's now hitting on the right side as well. So what's going to happen is every time I grind, I'll start to find more places until everything hits on all sides. Just a little bit on the top because it appeared that I could actually improve that. Okay, and now it's time to put it back on. Still primarily on the back. I look at this, we're still kind of open in the front, so we know she's only hitting back here. I'm approaching a point where I can no longer tolerate any more removal of the acrylic on the top. So now we look at our bite. know we can grind it in more on the lower. The lower is actually fairly thick. Nothing hitting on the right side. It's holding paper on the left in a couple of places. And the lower is actually quite thick. And now we're going to get another piece of paper. Have to show this down.
I don't know if I let go if I can redo it.
And I'm going to go with a thicker piece of paper that's blue. I switched papers because the other one was getting too many holes in it and losing its carbon. Still, we're pretty healthy on the back, so I know we can